Hello everyone. So before going into the video proper of today, I would like to give a bit of introduction regarding the same. I am a first year pathology resident and this video is about the first conference I ever attended. And it's a national conference and I also presented an abstract paper in the presentation. So this video is the journey from the selection of topic to data collection, followed by writing the abstract, uploading the abstract, getting it approved, and then finally presenting it in the conference, and also the 3 days of conference, how it was. So I've followed up on this video from the last 3 or 4 months. I hope you guys like it. Let's get to it. Hi, it's a Sunday today and fortunately I don't have a duty today. So let's see how a non-duty Sunday looks like in the life of a pathology resident. So it's almost afternoon. I slept in late because I had my duty yesterday. I came back around 3 o'clock and I woke up in the morning around 10:30, had my breakfast and was planning how to go about the day. And now it's almost 2 o'clock. I'm going for lunch and then I'll be going to the department as I have to do a bit of data collection for 2 papers that I'm supposed to write. As there are 2 conferences this year. One is a HematCon 2023 happening in Bhubaneswar in November, and AppCon in AIIMS Delhi happening I think in December 2023. And so this is all the data that I am supposed to analyze and find out the cases that are required for my paper presentation. Let's get started. I was assigned a topic by my professor and I was asked to collect the data regarding the same. So data collection usually happens when you find all the cases that you reported, get the history and then enter everything in the Excel sheet. It usually takes a lot of time. So this is me finishing the sample collection of almost 30 patients, and then I think I am talking about how to organize them in the Excel sheet, and that's all for the day. Hi, so today is my abstract submission day for my HematCon and I'm passionately late, really late. So my data collection is still not over. Actually my data collection is over, but my data analysis is not over. And since I am in a bit busy postings right now, I am not able to give more time to the abstract, so it's still pending the data analysis for the last day of the abstract submissions. Today I am planning to talk to my professor and see what we can do about it. If we can just submit a 50-word abstract regarding whatever data I have analyzed, I will talk to him about it and see how it goes, hoping for a positive answer. So my abstract is submitted, however the date has gotten extended, but I'm happy that I'm done with it finally. Fingers crossed, let's see how it goes. Hello, so today is 27th and today is the last day of abstract submission for HematCon, which is going to be my first ever conference as a PG resident. So I'm lagging behind. I have so much work to do. I don't know, I'm scared right now. To finish up whatever I can in the time that I've gotten, and I think it's almost done. Let's go back to the department. So I finished my academic block work. I met my professor and then got my abstract corrected, and he has told me to make another few changes, so I'll be making those changes and then I'll be leaving for home after finishing my work in the department and write up my PPT and then submit it before 12 o'clock. So fingers crossed. So So here are my tips for anyone who's starting out their first paper or any research publication or their first conference is to always start. Ask your professor, discuss it with them and begin somewhere. I know it's scary in the first time because as UGs we have not done that much research. At least in my case I had zero experience, but it's always better to ask and start doing it than waiting for the right moment to start your first research paper or poster. Hi again. So it's almost 10:30 and I'm done with my abstract writing and PPT finalization. So right now I will be uploading it to the conference website. So Hematicon is the first conference that I'm ever going to attend as a first year PG. Quite excited and nervous because it's just in 6 more days. So today is 27th. It's on November 3rd. And I have to do a lot of reading and prepare really well because again it's my first conference and I don't want to mess it up in any way. So fingers crossed, let's upload it. And it's done. I've managed to submit my presentation before 12 o'clock. I think it's almost 11 o'clock and it's done. So today is the first day of conference and we have workshops in our college. I will be attending the workshop regarding coagulation studies. This is me on the night of my presentation for the next day, and I was really tired from the conference that I just came back after finishing my work and I slept and I woke up really late. So I'm just making coffee for myself so that I can have all that energy for the rest of the night so that I can read whatever is possible in the time and hopefully present my paper really well tomorrow. Again, it's a very nerve-wracking thing because it's my first presentation and I don't know how it happens in national conferences. The guidelines of this paper presentation is that we have to present our paper in 6 minutes and then in the next 2 minutes the judges will be asking questions regarding a study on how we did it, on why we did it, and how we are going to implement the results in a society, in the research society or in the hospital regarding the same, and what new does it bring to the community. So I was just timing myself here to see if I can finish my entire presentation in 6 minutes, but I think the first time it ran ahead, so I did it again somewhere. It came around 6 minutes 48 seconds. So I think I can just skip a few details and get my presentation done in 6 minutes. So to anyone who's going to attend a conference for the first time, let me tell you some things about it. So the first one is to always approach the registration desk for anything if you have any confusion regarding it. And the second one that I actually missed is to carry the itinerary with you. You have to read this after your poster presentation is done. You have to read through this and just try to keep up with it. And the third one is, so most conferences happen because you're sharing a lot of knowledge, new research material into the society where the practicing clinicians and pathologists are there. So this is a community of hematologists, general medicine people, whoever is interested in hematology, followed by
pathologist. So I met a lot of amazing faculties, and oh my god, I was so excited. So we met Tejan, my professor was really kind enough to introduce us to a lot of professors who are really eminent in the field of hematology, and one such person is Dr. Tejinder Singh. We met him and I was really fortunate to talk to him and even click a picture. Total fangirl moment, because that is one book I've seen all my seniors recommend for studying hematology, and to see that person right there in person, I was starstruck. Then I met a lot of other professors in hematology, both clinical hematologists and hematopathologists, who were talking about things that we should do, like we as pathologists and we as postgraduates can do. And they motivated us, taught us about AI in hematology, which was really interesting to hear. And there were some professors who were really kind enough to explain an entire concept to us and asked us some questions. So the interactions, you go to a conference for the interactions, and I think if you have a faculty who is kind enough to take you everywhere and help you meet other people and communicate with them, you look up to people. So as a pathologist or as a pathology resident, I have always heard that this is a paraclinical branch. That is what most people say. And everyone says that it is inferior to the clinical branches. And people, where I felt that this conference is amazing, and also I got really starstruck. And they taught us how important we pathologists are for the diagnosis of any disease, a hematological disorder, and it was wonderful. So they gave me a lot of motivation and it was so much fun. I recommend everyone to attend a conference when you are in your PG, UG. It is the best place to learn stuff. And if you're nervous, or also if you are underconfident, it is okay. Please do not back out from not participating in events like this. They are a real part of your growth opportunities, where you can grow as a physician or a pathologist or a lab a microbiologist, or no matter what field you are in. Attending conference is always the best thing. So today is my first day. Let's see how the second day and third day goes. But I'm really happy. So as a pathologist, I thought that probably there won't be much development in my field, and I would just be limited with seeing slides and everything. But I'm really glad that I attended this conference, and I realized that there is a vast chunk of opportunities that is waiting for me out there after I finish my residency or during my residency. And the people I've met, they're totally inspiring. It's nice. So if you think that your field is lagging behind, or if you think that you're not interested in your field, I think you should attend a conference. Yes, that is what I think. I think you should attend a conference if you have taken a subject just because your rank was not that great or anything, so that you know what that subject offers you. And if post that conference you still don't like your subject, go ahead and prepare again. But I will tell you, I think once you attend a conference regarding your subject, you'll eventually fall in love with the subject. And so I was always in love with pathology, and now I fell harder for the subject again after only the first day of conference. I'm glad that I attended it, and I'm really grateful that my faculties and my professors gave me the opportunity and gave me the leave to attend this conference. Touch wood, I'm really happy. So that's all the rant for the first day. Meet you guys on the second day. Bye.
First you have to suspect. If after suspicion you have to establish the diagnosis, then etiology has to be done by that in the more specific, and if that is negative, go to the PS and ultimately analyze the clinical findings.
And we are done for the second day. Looking forward to the last day of the conference tomorrow. On the last day of the conference, we attended the quiz competition followed by a few talks. And this is the end of my first conference ever. I hope you guys liked it.